Soothing the savage breast. Yes, it's a quote from the playwright William Congreve, and it's very often misquoted as the soothing the savage beast. Perhaps one of the most common misquotes in English literature. Music has been extolled for its healing powers since antiquity. The Egyptians called it the word of the gods. The Greeks referred to it as the music of the spheres. The Chinese described the celestial energies of perfect harmony. And most of these societies would attribute spiritual, perhaps even cosmological significance to the power of music to influence us. Apollo was a Greek god of both music and medicine, among other things. And his acolyte Orpheus obviously had a reputation for the use of therapeutic use of music. Centuries later, music was used in the treatment of King Philip V of Spain, Ludwig II of Bavaria, and George III of England. You remember the madness of King George. The connection between mood and the musical term mode is not an accident, because music influences our emotions very powerfully, and it has many medical applications. I've listed a few purported ones here. It's supposed to calm people undergoing surgery, manage pain in hospices and dentistry, bolster the immune system, can revive memories in the elderly, and Alzheimer's patients. It can improve fluency in speech disorders. It can motivate or pace Parkinson's patients. It can reduce epileptic seizures. There are studies showing that it can enhance stroke recovery, and it has powerful social bonding effects, particularly if people are performing music in a group situation. It can also influence consumer behavior. If classical music is playing in a wine store, you're more likely to buy expensive wines. If they're playing pop, you buy the plonk. If you're playing Italian music, you buy Italian wines, and German music, you tend to buy German wines, and so on. A very interesting one is the capacity of music to control vandalism. They play classical music at railway stations. It significantly reduces the amount of vandalism. And you might suppose that it's because it's soothing the savage breasts of the vandals. In fact, it's probably just driving them away. Fewer vandals, less vandalism, because vandals don't usually like classical music. Of course, music can be used for good or ill. There are possible negative effects which I will get around to. Obviously, music is used to drive soldiers into battle. It is used in supermarkets to persuade you to buy a whole lot of stuff that you didn't want in the first place. It can theoretically break down sexual inhibitions and provoke anti-police violence. Certain types of music may even promote depression or even suicide, which I will come around to again later. Now, when we describe music as moving, this may be literally true. Very few people can listen to a musical like Anything Goes or Crazy for You without their feet beginning to tap just a little. And clinically, it's been found that some patients who are virtually paralyzed can be prompted to walk by rhythmic music. The comedian Terry Thomas said that at one point in the latter stages of his Parkinson's disease, he was unable to walk through a doorway, but he could dance through it. If he got up a rhythm of 1, 2, 3, 1, 2, 3, he could get through the doorway. So the rhythm of music can have motivating effects. It operates by a pacing, or sometimes called entrainment, of the physiological rhythms like heart rate, blood pressure, respiration, brain waves, and perhaps even the walking gait. It picks them up and can tilt them one way or another. The experience of the mother's heartbeat in utero may be prototypic. Around 72 beats per minute is very relaxing for babies and indeed for us. If you increase the tempo of the music, 80 beats per minute and beyond, it is inevitably a little bit exciting. So if music accelerates beyond 80 beats per minute particularly, then it tends to be arousing. Slow and regular rhythms are soothing, used in lullabies particularly. Soft music, of course, is relaxing. Loud music, and particularly dissonant loud music, may be anxiety-evoking. You've got very repetitive rhythms. They can induce a trance-like condition, and they are hence used in ritual behaviors like religious ceremonies and orgies at the tribal level. Because what you can get is a sort of dissociation or a loss of conscious control, maybe even convulsions. And according to the cultural context, these can be variously interpreted as hysteria, fanaticism, possession, or perhaps religious ecstasy. Not just humans respond to music, but animals do as well. Dogs in animal shelters have been shown to be soothed by classical music. They spend more time being quiet and resting. Whereas heavy metal, for example, will lead to more time spent barking and looking agitated. Other studies have found that milk yields in dairy cows are increased with slow as compared with fast tempo music. And rats exposed to stress-inducing rock music are slower to heal. Their wounds are slower to heal. The other indications that there's a biological basis to the effects of music are seen in the spectrographic analysis of different types of music across cultures. Mourning songs in all, that is, grief-type mourning songs, in all cultures tend to have slow, downward-pointing rhythm, harmonic patterns. Joyful music tends to be upbeat and energetic with rising melodic phases. Sad music in all cultures tends to be placed in minor keys and again has relatively descending phrases. Dissonance in all societies is recognized as being unpleasant, anxiety-evoking, and babies as young as 4 months will respond negatively to dissonance as we know it. Brain scan studies confirm that people, when they experience chills or frissons or thrills or shivers down the spine, it's got various names attached to it, when they are listening to some of their favorite music, show patterns in the brain which are equivalent to druggies taking a hit. There's an increase in dopamine and activation of the reward centers of the brain, particularly those in the mesolimbic area, if you know your brain anatomy. It's also been discovered that the activation of these reward systems is reduced in depressive patients. They show a diminished response to listening to music in terms of dopamine production. So it is possible, of course, that if you can get people listening to their preferred music, you might actually evoke more of this thing, dopamine. And incidentally, it is also the neurotransmitter that is useful to patients who have motor disorders. Although the circuitry is a little bit different, it is possible that people with movement disorders might also be helped by the extra production of dopamine when listening to pleasurable music. Music seems to be effective in reducing pain after surgery or in palliative care, hospices. although it's a little bit disputed because the results are always much clearer when you're asking people to report on the levels of their own pain, as against studies in which you measure the amount of self-administered analgesia that people are using to control their own pain. One would have hoped that if the music was truly effective in pain control, they would use less of their analgesia, but not all studies show that. However, if there are positive benefits in pain control, then this could be due to distraction of the music from the painful reality. It could be due to relaxation, because sometimes when people are stressed and their muscles are taut, they feel more pain. It may be due to a sense of control. There are some analgesic situations where you are given a dial to control the amount of the loudness of the music, and the idea being that if the dentist is causing you more pain, you can turn up the music a bit. The idea there is that it gives the patient a sense of control, which can be helpful in combating pain. And it may also, of course, work through the release of dopamine or endorphins, which are internal pain control chemicals. A number of studies show that if you use mood-enhancing music, it will reduce stress hormones, notably cortisol. It will increase DHEA, which is a steroid associated with mood and memory and general health. And it will potentiate certain measures of immune function, notably immunoglobulin levels. And this seems to apply both to healthy individuals and people with clinical conditions such as anxiety, depression, chronic fatigue syndrome, and arrhythmias. There are cardiovascular variables which can be entrained, particularly with classical music, according to studies of Bernardi and colleagues. Crescendos were found to cause vasoconstriction, hence raising blood pressure, whereas more slower, regular sorts of music lowered blood pressure. And these were effects that applied to patients regardless of whether they had any musical training. Other studies have shown that relaxing music will lower anxiety in preoperative settings, allowing a reduced need for pre-medication. In this particular study, the effect of the music was equal to the effects of the pre-medication, such that you could virtually substitute one for the other. Recovery from heart surgery was found to improve with classical and meditational music, whereas heavy metal and techno had the reverse effect, and these researchers concluded that it might even be detrimental to people recovering from heart surgery. Now, the impact of music may depend upon its mood-enhancing capacity, and not just its tempo and its volume. The emotional impact is probably important, and there are some medical benefits that seem to depend upon the music being enjoyed by the individual. Studies by Miller and company at the University of Maryland Medical Center asked patients to choose music that for them personally was joyful against music that they would regard as being annoying or anxiety-inducing. And they found that on various blood circulation measures, the joyful music would improve circulation, whereas the self-nominated anxiety-evoking music would impede blood circulation. You can see one of their graphs there. Yes, this is the baseline measure, Joyful music tends to, each line represents an individual patient, and mostly they're on the way up with the joyful music. With the anxious music, some of them are coming down quite steeply, many others are just sort of running parallel, but overall, on average, the anxious music was detrimental to their blood circulation. There's another study by Soto and company reported, it was looking at patients with stroke damage to the brain that caused something called visual neglect, which is that although they can see everything in the visual field, there are areas, might be the left field or the right field, that they do not seem to be responsive to. They behave as though they are not seeing it. And in this particular study, they found that when tasks were performed with preferred, that is, pleasant music to that individual, their visual neglect was improved, but there was no change if they were listening to non-preferred music or if the tasks were being done in silence. So preferred music overall is probably going to be better for us. That might not come as a great surprise. Now, interesting thing here, why is it that to some extent we choose to listen to and appear to enjoy sad music? That doesn't seem to make sense, does it? One explanation is that it gives us a kind of empathy. It reassures us that other people are feeling the same sorts of pain and distress and grief that we feel, and therefore we are not alone. Some simple-minded people think that if you go into a hospice or a ward full of depressive patients, then what you need to do is to play some jolly music to jolly them up a bit, make them feel better. In fact, that can often be counterproductive. You are better off validating their mood, meeting their mood, showing that you know how they feel, and they very often will prefer sad sorts of music in that situation. There are studies, often use Barber's Adagio for strings as sad music. I don't know if you know that piece, but it's of course associated with the film Platoon, and I think one of the 9/11 concerts played that Samuel Barber music. And Huron's work suggests that it probably reduces prolactin, which is a hormone that is associated with motherhood, but also connects with weepy feelings. And the idea is that it provides consolation. And if you're being provided with consolation for a grief that is not real, that at some level of consciousness or cortical process in the brain you realize that the grief is unreal, then you may be left with positive enjoyment on balance. At least that's the theory that Huron has been working on. Rather like the release of adrenaline within a safe circumstance like a fun fair may be an exciting thing, whereas if you were really being pursued by a saber-toothed tiger, it may just be too exciting. Huron also believes that nostalgia in music is associated with the secretion of another hormone, the bonding hormone oxytocin. He hasn't as yet managed to prove that, but there are indications that he might be on the right track. Music is a very important component of what is called reminiscence therapy for older people with dementia particularly. The idea is to re-stimulate happy memories from the past and induce a sense of familiarity and security. Music seems to have a better chance of connecting with patients in long-term coma than speaking to them does. There are a number of fairly well documented instances of people that have been revived from coma by music that has some very special personal significance to them. A researcher called Janata has found, he says, an area in the dorso-medial prefrontal cortex, that's sort of around about there, top of the forehead, or behind it anyway in the brain, that links familiar music with salient, emotionally charged memories from our past. You might call it a hub for musical nostalgia. You can see in this diagram that he classified music, or measured several dimensions of music. Familiarity is in green. Music that was rated as enjoyable, its brain effects are shown in blue in this diagram. Memory-evoking music is in red, and that which is both familiar and evocative, that is both green and red, is shown in yellow in this diagram. And this is the brain hub that he is referring to. And interestingly, it's one of the last areas of the brain to atrophy in Alzheimer's disease patients. And it may help to explain why music continues to elicit strong emotions in Alzheimer's patients, almost at a time when virtually nothing else will interest them or engage them. You've probably heard of the Mozart effect. Well, the original finding was that a particular piece of Mozart, K448, would improve performance on spatial reasoning tasks. Now, that initial finding hasn't always been replicated, but a finding that has stood up quite well is that people who are prone to epileptic seizures, children in most of these studies, have a reduced likelihood of seizures. Perhaps the seizures are reduced to half their previous frequency if they listen to K448 shortly before bedtime. It was a benefit that was found to last for at least 6 months. You might suppose that they would get bored with the music or something. You'd have to find another piece to get the same effect. But in the study of Lin and colleagues, that effect was sustained across 6 months. Exactly why that particular piece should have that effect, we're not sure. I don't know, you probably don't know it, but it's like a brisk march. It's very uplifting music. Straight up and down, I suppose, in terms of its harmonic pattern. Its tempo is pretty regular. The structure and consonance, predictability are all at a fairly high level. In other words, it's not complex, dissonant music that would require a great deal of concentration to process it effectively. You might have a listen to it on YouTube when you go home. But the interesting thing is that it may not be unique to Mozart. There is a song by a Greek-American singer called Yanni. It's called Acroali Standing in Motion. Apparently that has been found to have a similar effect, and interestingly it has similar tempo, structure, consonance and predictability to the Mozart piece, even if you might not rate it quite so highly as a masterpiece. It nevertheless has been shown to have a similar effect. Again, it's something you might have a listen to on YouTube. When you pick up my script on the way out, you'll find the references and names, so you don't need to be noting them in here. Now, here's a very cunning study by a group of researchers, Hussein and company, who analysed more closely what might be going on in the Mozart effect. They took the original K448 and they produced a version that was rather faster than the original, about 35% faster. And they also produced one that was slowed down to about half the pace of the original. They also had K448 transposed into a minor key. And this little bar graph is showing you the effect on spatial performance of the four versions of K448 that were so constructed. And you can see that the one that is fast tempo and in the major mode is the one that produced the highest spatial ability scores. They were independent samples, incidentally. Each of these were four separate samples of subjects. Slow tempo, as I say, wasn't quite so effective. The major mode seemed to be more effective than the minor mode. So there are some of the characteristics of K448 that might be important to the improvement of spatial performance and perhaps also the reduction in epileptic seizures. They also asked subjects how they felt with those different types of music. And the fast music, fast tempo one, tended to produce higher arousal on their own self-report. The minor mode tended to make them feel less positive in their mood. The major mode produced the more positive, joyful mood. Perhaps not surprising, but that might be what is mediating the effects on spatial ability scores. You might wonder why Mozart would have an effect on epileptic seizures. And the researchers themselves don't know. I don't really know, but one wonders whether the music is in some way exhausting or satisfying the circuits that would otherwise fire spontaneously and create an epileptic seizure without that musical experience. I don't know. That seems to make intuitive sense to me. People who practice music therapy in the Nordhoff-Robbins tradition usually work one-on-one, and they work especially with learning disabled and emotionally disturbed children. And the theory is that they are opening a channel of communication or expression with these children that does not require high-level language skills. The exact program is tailored to the needs of the individual, what they're capable of particularly, and what kind of problem they seem to have, but it very often involves an improvised musical dialogue between the therapist and the client, so that they are bouncing off each other. I don't know if you remember the film Deliverance, but there is a sequence in that called the dueling banjos, which became separately popular from the film, in which one of these city-dwelling New Yorkers who had gone up into the Appalachian Highlands for a rafting experience encounter some of the hillbillies, and they have some difficulties communicating with them, but one of these guys is a banjo player who manages to get into an exchange with one of the local boys that turns around the whole relationship. It's again, it's something you would find on YouTube if you look for it. It's amazing what you can find there. The idea of vibroacoustic therapy is that vibration may be delivered, particularly musical types of vibration, may be delivered directly to the skin surface of an individual, either by direct contact or through a medium like water. And this is recommended especially for cerebral palsy and arthritis, among other conditions. Various devices, patent devices, have been offered. There are mats, there are chairs, there are baths. Some of them combine vibration with musical sound, and some of them have light shows on top of that. And they have further extensions into relaxation for businessmen or sports people who are just off the football field or the golf course or something. And usually the experience is enjoyable, that has to be said, but scientific evaluation of positive benefits is rather sparse. Which raises the whole question of evaluating music therapy. A lot of the reports on music therapy are clinical case studies, which are a little bit anecdotal. Some of them will use qualitative approaches to research, but very often they don't meet the standards of scientific research in terms of methodology or statistical analysis. One of the big problems with a lot of the clinical and qualitative research is that the person who is delivering the therapy is also the one who is evaluating its effects. And, of course, the potential bias that is introduced by that is considerable. So, of course, the gold standards for evaluating treatments generally are random controlled trial and meta-analysis, which is ganging up all of the researchers, collecting it all together and seeing what uniformities come out of it. It has to be said that it's rather difficult to apply those ideal research approaches to humanistic therapies generally, because they are so complex. There are variations in the client types, the details of the procedure, there's often lack of agreement about exactly what outcome is being sought. Nevertheless, some fairly consistent findings come out. The meta-analyses tend to show that treatment effects are greater for women than for men, and greater for children than adults. But infants actually show the least response of all. Why that should be so, I can only presume that women are generally more emotional creatures and therefore will get more of an emotional experience out of the music, and therefore it will be more effective for their situation. And perhaps the same with children and adolescents. Perhaps they are more open to experience, get more out of the music, and therefore it is more effective as a medical treatment. Maybe the infants are just too young to process music effectively. There have been studies using meta-analysis to look at the effects of music in alleviating symptoms with cancer patients. And they claim beneficial effects on anxiety, blood pressure, pain, mood, quality of life. Certain other things were not improved. They couldn't detect any improvement with respect to fatigue or physical status of the patients. One interesting finding of this particular meta-analysis was that it didn't seem to matter whether the intervention was delivered by a trained musical therapist or was just supervised by medical staff within the hospital. The two were equally effective. It is possible, as Lindsay has argued, that live music in hospitals and perhaps particularly hospices carry an additional component that is beneficial, that of the personal touch, the feeling that somebody who is actually there for you, that it's a little bit more hands-on, perhaps, than just listening to the radio or putting a set of headphones on. Now, even when a study appears to be randomly controlled, it may be difficult to know whether the control is fully appropriate. There's a study here by Hanser and Thompson, for example, which compared music listening guided by weekly visits from a therapist with self-administered music, with telephone backup from the therapist to call them up once a week and say, how's it going? And just sort of monitoring them and showing an interest, And the third group was a waitlist control. That is, nothing special was done to these patients. They were just told that they were on the list for treatment, and when your turn comes up, we'll let you know. It's quite commonly used as a control. In this particular study, both the two music groups, 1 and 2, actually did show... Where is he? There he is. 1 and 2 were more effective than the waitlist control. And using measures of self-esteem and mood. And the researchers concluded that homebound elders will benefit from music interventions of both sorts. Although you'd have to say that that would be more expensive than that one, so you might as well use that one. But there is a problem, isn't there, that it might be that both the music groups were effective because of the feeling that they were being helped. In other words, it might not have had anything to do specifically with music. So here's a slightly better controlled study using measures of stroke recovery in patients who had recently suffered strokes. Monitoring improvement in the early post-stroke phase. And in this case, the controls were not just no music controls, but a group that were read audio books, which you would think is a kind of intervention that would show equal concern. But it was pretty clear in these findings that verbal memory, for example, let's just take this one, verbal memory improved best with the music group and not so well with either of the others. BL stands for baseline. That was the first measure taken. This measure is 3 months later, and this is 6 months later. So verbal memory was improving best with music as against both audio books and the control. Here's another one. Attention, focused attention, was improved with music, but not with either the no music, no speaking control, or with the books alone. And similar things were found throughout. But it was pretty clear overall that recovery from stroke was benefiting from music listening as against not just a no music control, but with reading of audio books. The benefits of music are not just in the listening, incidentally, they can also be in the performance. Singing has particular benefits, for example. There are studies that will show that singing will improve respiratory and cardiovascular, aerobic effects, if you like, almost like a sport, but singing actually exercises the respiratory system better than most activities. There have been improvements in neurological functioning, like alertness and learning, have been demonstrated by singing. Enhanced immune function. Cathartic effects, the feeling of unleashing emotions, and enhanced mood. And of course social benefits, because particularly if you're singing in a choir, you've got rapport with a number of other people that you are performing with. And social bonding can be a very important part of music. We create powerful social bonds with people that we share similar tastes and and preferences and leisure activities with. So if you are listening to the same kind of music or going to the same kind of concerts, you will tend to form bonds with those people. And hence you will get social benefits that may be useful in counteracting loneliness and depression. And if you're performing with other people, you're likely to form bonds with them as well. The couple in the photograph here you might recognize as Beyoncé and Jay-Z, who is her rapper husband. They met performing together, and you may or may not be surprised to learn that they're in the Forbes list of the richest performers in Hollywood. I believe top of the list in some years. They're just minting it between them as a couple. Big money to be made in music, more often pop and rap than classical, it has to be said. Now, it's often been suspected that music may have the potential for some negative effects. Many people reckon that rock and rap are responsible for the breakdown of sexual restraints and increased aggressiveness in society, maybe even the recent riots. However, the research that's been done on this, looking at the sequence of events, would tend to suggest that pop is reflecting societal attitudes rather than being the driver of them. Insofar as it's possible to tease apart the cause and effect, it seems more likely that either the two are running in parallel, or the pop music themes and the lyrics and so on are reflecting current social attitudes. And when you think about it, of course, one of the main purposes of pop music is to crystallize the teenage rebellion. It's no use if your parents enjoy it as well. You'd have to find something else to annoy them with, your clothes maybe. And so you are choosing music that you know will set you apart from the parental generation. And if you look back over history, Jerry Lee Lewis, Mick Jagger, the Sex Pistols, Marilyn Manson, who is depicted here, were among those who created total outrage to the parental generation at the time. But if you, looking back over them, they just sort of seem like pantomime villains. In 1985, I was actually teaching at the university in Reno, and a British pop group called Judas Priest were put on trial, accused of having caused the suicide of two rather unstable drug-using young men who shot themselves. One of them survived, although he was horribly maimed. The other one was killed. And the accusation was that their suicide pact was caused by subliminal messages in the music of Judas Priest. Now, interestingly, it had to be subliminal because the American Freedom of Expression Act would prevent any such trial if the message was up front. But they were testing the legal possibility that implanting subliminal messages might be illegal and might get around the, what is it, the Fifth Amendment, is it, in America, which protects freedom of expression. Judas Priest were acquitted, and I think probably rightly so, because there was no satisfactory evidence that there were any subliminal messages implanted in their music, however nihilistic the upfront major themes were. But there is actually evidence of a link between an interest in rock and rap on the one hand and self-harm. Although again, it's very difficult to establish cause and effect, and more likely it is mediated by the social background and factors like self-esteem, which lead to both the suicidal impulse and the choice of music that has very negative, depressed and aggressive lyrics. couple of sociologists called Stack and Gundlach reported a link between the amount of airtime devoted to country music and suicide rates across 49 US cities. And they managed to show that this was independent of the divorce rate, the poverty, the southernness of the state, and the availability of guns. None of those would account for this. And they ended up suggesting that the recurrent themes in country music, things like marital discord, divorce, social alienation, alcohol abuse, and so on, might have the effect of promoting suicide by nurturing a pre-existing suicidal mood and reinforcing it, exaggerating it. They weren't actually saying that the country music was the cause of the suicide, but they were saying that people who had pre-existing mood problems might attach themselves to this kind of music before ultimately killing themselves. Incidentally, that that picture, I think, is a fake. I stole it off the web, and I don't think George Bush was actually there annoying that woman in the wake of the New Orleans floods, I think it was. Yeah. So, a summary of the medical benefits of music. It appears there is evidence that it will boost mood and indeed immunity. It can energize depressed patients and provide impetus for those with psychomotor conditions. It can relax people who are suffering anxiety and perhaps cardiovascular patients as well. Will revive happy memories and improve the quality of life in Alzheimer's patients. It may distract people from unpleasant realities, as in the case of cancer patients, or its use in analgesia. And it will provide a non-verbal channel of communication and expression for certain people, particularly learning disabled and stroke patients. And of course the social rapport I mentioned. That picture, incidentally, is not a joke. They really are Turkish doctors performing traditional music in a Turkish hospital. They're not musicians, they're the doctors. One wonders if they might be better devoting their energy to actually treating the patients directly, but it just shows that in many countries around the world, the potential benefits of medical benefits of music are well recognized. And I think we'll leave it at that. Thank you, Frank.